Coronavirus fears across the United States. Health officials are warning Americans about the disease that is coming in a bigger way. San Francisco has declared a state of emergency this morning to prepare for an outbreak. To recap the spread of the disease, back on New Year's Eve, China discovered a strange pneumonia-like illness, which was identified as coronavirus on January 7th. 4 days later, China announced the first death from coronavirus, and then on January 21st, the first case was confirmed in the U.S. On January 30th, the World Health Organization declared a global health emergency, and then on February 5th, the Diamond Princess cruise ship was quarantined off the coast of Yokohama, Japan. On February 10th, the official Chinese death toll from coronavirus surpassed SARS. And then on February 19th, hundreds of passengers evacuated the Diamond Princess. As of yesterday, 40 Americans from the cruise have been diagnosed with coronavirus, bringing the total U.S. cases now to 57. Joining us right now to discuss the government's response to the illness, Texas Congressman, House Energy and Commerce Committee member, and medical doctor Michael Burgess. Good to see you, Congressman. Thanks very much for joining us. Your committee will hold a hearing on how to address this virus later today. How serious is this, sir?
Well, as you know, I was on with you probably a month ago and said of all the infectious diseases this country has faced since I've been in Congress, this one concerns me more than any of the others. The ability to spread this virus before symptoms develop, even though it's less lethal than SARS, it makes it more infective than SARS, and that's why you've seen the number of cases skyrocket so much. I think the CDC yesterday, people do need to be aware that the community acquisition of this virus in the United States does not necessarily represent a public health failing in some way. That is likely going to happen, and I think it was reasonable for the country to be warned about that. But I'll tell you this afternoon we're having the first hearing in our committee, the Subcommittee on Health. I asked for this weeks ago. It is unconscionable to me that we have not had the experts in to talk to our committee. Yes, we've had off-the-record briefings, we've had other contact with the public health experts, but we need an on-the-record briefing that people can watch and perhaps get a better understanding of this illness.
Hold on, Congressman, you're saying that weeks ago you asked for an on-the-record hearing about coronavirus, and your colleagues in the House committee said they're not going to do it. Why?
They said we'd do it in 2 weeks, which is today. And my concern was, at that point, our numbers were going up so fast, where will we be in 2 weeks? Well, now we know. We had the super spreader situation in South Korea and on the cruise ship. This is something we really haven't encountered with some of the other infective illnesses. And I don't know that today we understand the phenomenon of the super spreader, but it is a feature of this, and that is one of the things that we have to figure into our preparedness response.
But why were your colleagues pushing back about having an on-the-record hearing? Because they were consumed with other things like taking down Donald Trump?
Yes. Well, it was a messaging bill on abortion that they thought was more important. I pointed out it's never going to be signed into law. This is more important. This is the clear and present danger.
Right.
But I'm glad we're having the hearing today.
Before you go, real quick, the CDC says that a pandemic is potentially coming here. How is Americans supposed to prepare?
Well, I think one of the things that I'm waiting to see is the ability to test much more rapidly. Right now, all the testing has to be done through the CDC because there were some difficulties with the original test kits. We've got to get that fixed so that our public health people on the ground back in our homes are able to test for this virus quickly and make the assessment, is this the flu as usual or is this that new virus? Without that rapid testing that is on site, you really can't wait 24 hours for a turnaround on this. The other thing is, if there's a silver lining to this cloud, maybe finally we will be looking seriously at why all of the active pharmaceutical ingredients are no longer manufactured in this country. We do need to look at manufacturing in a new light because of the very threat that an illness like this poses in another country.
Just to be clear, how much of our drugs, our generic drugs, come from China?
Well, I don't know specifically about the generic drugs, but I do know a significant amount of the active pharmaceutical ingredient. And this is not news. In 2008, we had contamination with heparin.
Yeah, no, we've been saying
it's
70% of generic prescription components are coming from China. It is a large amount. You make a good point that maybe this is a wake-up call. Congressman, good to see you, sir.
Great.
Thank you very much. The impact